So esteemed members of the panel, ladies and gentlemen, good morning. I'm Dr. Prateek Nishant from the state of Bihar. I came 1,000 kilometers to complete my post-graduation from AIIMS Rishikesh, and it is a pleasure and an honor to be speaking in Dehradun before two of the architects of my postgraduate program, Professor Sanjeev Mittal and Professor Ajay Agarwal, as well as all my teachers and colleagues from the state of Uttarakhand. My regards to Devbhoomi. My tryst with Community Ophthalmology in Uttarakhand began in the year 2017. So beginning with no relevant financial disclosures, I was brought by fate to the city of Dehradun in February 2017 to visit the IMA Blood Bank of Uttarakhand on a mission by the state Medical Registration Council to look at the practices of registration that were going on in the Uttarakhand Medical Council. But then somehow I landed as a junior resident after 6 months in the beautiful city of Rishikesh and this premier institute. And it was soon that we realized that there is an ecosystem for community service that has brewed in this institute and the state of Uttarakhand, because we have an ailing community with hard to reach areas with heavy reliance on road travel, less centers practicing high-end affordable eye care, different and unexplored spectrum of eye problems, and less facilities for patients with special needs. Now in this mix, I was fortunate to encounter a premier institution where there was a culture of outreach activities through an institutional corporate social responsibility, growing eye care facility open to learning on the go, a large initial team of resident doctors under able supervision, and where the importance of community ophthalmology was emphasized as well as tested. Things began with this camp in the Srinagar Garhwal region where there was this Shahidi Mela, my regards to the brave sons of the soil. And here I was taught the importance of a basic camp medicine kit and the importance of early proficiency with torch and other handheld instruments, as well as making use of meager resources such as epilation using a locally manufactured pair of tweezers. Later we went to a Tehri Koteshwar camp where a low-cost technology like this printable visual chart was delivered to a dispensary that was there. They did not have a vision chart, but so we carried this chart along, and we left it there and taught the medical officer who was there how to use this chart and how to refer the patient to AIIMS Rishikesh. Simultaneously, the data collection and tablet computer-based data entry, I had a first-hand hands-on experience. The camp among laborers in Rishikesh was another encounter with this underprivileged community, where we acquired knowledge about diseases prevalent in this specific community, as well as the channel of referral through which has to be affordable as well as convenient. So this channel had to be established, and this was learnt through experience. The camp among deprived sections of the society in Dehradun, this happened to be a Nanhi Dunia, which is a school which serves the underprivileged children from marginalized communities, which helped me recognize the health problems of children with special needs, propagating channels delivering affordable medicines, importance of a cheerful and healthy atmosphere while these children learn and grow, as well as serving otherwise marginalized sections as our own. This was a landmark that our institute conducted. This was a camp over a period of about 60 days. And our institute served about 25,000 OPD patients in a makeshift hospital that was created in Prayagraj. And this paper was published by our institution regarding the pattern of ocular morbidities among the pilgrims attending the Netra Kumbh Mela, and coupled with the social responsibility of delivering free spectacles, this was a massive success, and we were happy to be part of it. So teamwork is the key, and ultra high volume eye care is not only a possibility, it is a reality. It was revealed to me in this particular eye camp. Our institute was fortunate to receive the Government Sector Performance Award for 80 plus days of outreach camp in 2018 and 19. Simultaneously in-house, we pioneered the eye banking in government sector in Uttarakhand through our institute. My responsibility was not only to cover the 2 p.m. night to 2 a.m. Midnight calls for cornea donation, voluntary cornea donation all across the state, but then I was also fortunate to contribute to designing the IEC materials that are present in our hospital, as well as the website of the Rishikesh Eye Bank. So to channelize interest to build instruments of change is what I need, what I learned through the eye banking initiative of our hospital, and working towards the goals which align with the national programs is something that was introduced to me. In-house awareness during the World Glaucoma Week, again this poster was designed by me, of course supervised by my consultants, and this is something that my interests, which when translated into reality, come out as. My tryst with research in community ophthalmology came out when I was fortunate to receive the AIOCMT3 Community Eye Health Research Grant, and on the right you have the presentation, the final presentation of the project which was completed. On the left you have one of the publications we have in Indian Journal of Community Ophthalmology. So I learned that community-based research is very different from hospital-based research, and impactful community-based research has a potential for actionable policy reform. Finally, this was Guru Shri Gorakshnath Swasthya Seva Yatra in Uttar Pradesh, Nepal border, where I was invited to serve through my institution. And this was a border area. This was supposed to be a zone inside the dense forest with no mobile signal, no proper facilities, no proper accommodation. And fortunately, I was able to supervise a team of 3 to complete my part of this eye camp. So this made me learn that life throws unexpected outswings, and one needs to play them with best efforts without thinking of the rewards. But when the rewards do come, such as that on the right, they are very pleasing and very satisfying. In conclusion, junior ophthalmologists can contribute to community ophthalmology in more than one way. A strong administrative will for supporting community service is essential, as is personal dedication. One ought to travel to hard-to-reach areas to experience hardships faced by the ailing public. Standard practices coupled with physical infrastructure, resources, and dedicated care providers is the formula with track record for success. And community ophthalmology is a mindset. Once you're in, there is no turning back. My commitment towards unconventional path stems from the promises made to these 2 legendary individuals, Professor Dr. Rajwardhan Azad and Dr. Partha Vishwas, who asked me, what do you want to do in life? And I said, I'll take an unconventional path forward. The next level in community ophthalmology is Akhanjyoti Eye Hospital, where I am currently working. It is Eastern India's largest eye care network, which now has an emerging center of excellence, a 200,000 square feet area with 11 operation theaters, and an upcoming Institute of Community Ophthalmology, a research foundation, multidisciplinary laboratory, and Bihar's largest ever DNB ophthalmology program. It was host to the Coin Bihar chapter conference in 2024, and the path is ongoing. So thank you very much, and it has been a pleasure.